Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about the upcoming CMS changes that go into effect July 1st, 2025. July 1st is an important date because we have completed the first half of the year, and Medicare and Medicaid will make some changes when it comes to certain aspects of healthcare that go into effect that date. There are other places that can, there are other entities that can make changes go into effect at that time as well. So I'm going to just talk about some of the big heavy hitters that will be changing July 1st. However, again, like I always say, this is an informational video to put awareness out about the changes. It is not going to provide all of the details that you may need in order to learn and adopt these changes in your practice. So please do your own diligence. This is just to spread awareness on what kinds of things are going to be changing. And if you feel like you need to know more, then you should do your own reading and research. Okay, so I have my notes here. One of the biggest changes coming are for the federally qualified healthcare centers and rural healthcare centers. So if you're an FQHC or an RHC, yes, you would totally know if this is you because you have to go through a lot of different certifications and qualifications to become recognized as an FQHC or an RHC. But they are going to start being able to be reimbursed for Part B vaccines on fee tickets, like for fee for service at the time of service when you provide those services, those vaccines to patients, rather than having to wait for you to send a cost report in to CMS and waiting for them to reimburse you for it. So this is really great because vaccines are not cheap. And of course, for the ones that you have to pay for out of pocket, you do want to try to get that payment as soon as possible so that you can pay your invoices to the distributors. And what was happening before, it sounds like, is when a Part B vaccine was being given, you had to put it on some kind of cost report. And I don't know how often that was, but it had to be sent to a certain entity and then they cut you a check for all of them. Where now it sounds like they can bill it out on their claims and they'll get reimbursed faster, which is fantastic. So that starts July 1st. So if that affects you, if you're an FQHC or an RHC, definitely be looking into that further if you were not aware of it. The second thing actually affects the dental field. And I know I do not do any videos on dentistry or dental field type situations because I've never worked in a dental practice. I am completely naive when it comes to all of the dental billing requirements. But there is a change July 1st that I wanted to bring to your attention. And it says that it is going to require diagnosis codes on dental claims if inextricably linked diagnosis is covered in the medical services benefits of a patient's plan. So it has to be very convincing, very obvious that the diagnosis in which the patient is being treated for some kind of dental situation is covered, but the diagnosis codes need to be on those claims for them to be paid, which is fantastic. I know that it's always a struggle to get medical benefit reimbursement for dental related items in the past, so hopefully this makes it a little bit easier. This is mainly going to be probably for like urgent cares. It's going to be for hospitals. This is going to be maybe even for dental clinics that treat people for medical conditions and bill the patient's medical insurance, okay? So basically diagnosis codes have to be a covered medical service and it needs to be inextricably linked. And that's quoting. The third thing, and so this is the biggest, these are the three biggest things that I saw. So this is the third one. And the NCQA, which is the National Committee for Quality Assurance in Healthcare, they are going to be changing their reporting requirements and credentialing standards when it comes to verification and checking exclusion lists and monitoring and things like that. If you are certified by the NCQA, if you are involved with the NCQA in any way, this is going to be very important, especially this affects mostly larger groups, hospitals, credentialing organizations where you credential patients, and you credential providers and credential groups where required. This is going to affect you majorly. I am going to do another video about more details of these changes because I feel like that can be a video on its own. So I'm just going to do a high-level overview of that separately, but just know that there are going to be some changes there. So the top three things that are going to be changing July 1st, 2025 with Medicare and Medicaid is you're going to have FQHCs and rural health clinics going to be able to bill out for their Part B vaccinations for faster payment. You're going to have diagnosis codes required on dental claims for medical services if they're directly linked. And then you have the NCQA reporting program changes to credentialing and contracting requirements. Of course, we always see some kind of fee changes on CPT codes with Medicare and Medicaid for July 1st. That's within the last few years. That's kind of a new thing. So that will also be taking effect. So just make sure that as of July 1st, you're paying attention to your reimbursements from Medicare, checking to see if there's any new fees or changes to reimbursement for common codes that you bill, and just do a very fast overview Google search of any other changes that might be coming that affect you starting July 1st. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with your colleagues whom you feel would benefit from the information. Thank you so much for the support, and we will see you next time. Bye-bye.